Hello, my name is Sona Repetian. I'm a United States University student. Today is November 23rd, 2025. It is approximately 12 p.m. This is for a recording for Nurse 572 class. I am going to do a assessment for HEENT, which is head, ear, eyes, nose, and throat exam. I'm going to do a 360 of my working space area, and I am going to introduce my client. Still in view. I'm going to do ceiling, going to do floor, counter space. Here we go. I'm going to place my recording. Wonderful. Am I still in view? Yes, I am. Hello. Before we get started, can you please state your name and would you also give me permission to record this video and post it on YouTube for my professor to view and grade? Yes. And what was your name? Masha. Thank you. So I'm gonna start my assessment now. Entering the room. Knock knock. Hi, I'm Sona Repetian. I'm a nurse practitioner student. I'm going to do a head, ear, throat, head, ear, eyes, nose, and throat exam, which is called HEENT on you. But before we get started, I'm just going to verify your name and date of birth. Thank you. Can you please state your sex, gender? Thank you. And do you identify yourself as a female? Yes. Perfect. And before I get started, I also want to do head hygiene. And I'm checking my environment. My environment is safe. Um, what brings you into the clinic today? I've been having a little congestion. And how did you get to the clinic? I drove. And are you a good historian? Yes, I am. Thank you so much. So I'm going to start my assessment. First, I'm going to do an inspection of your head, your scalp, and I'm going to look for like contouring, any bruises, any protrusions, cysts, lumps, and all that stuff. May I go ahead and touch you? Thank you so much. Still invisible. Okay. So I am inspecting your skull. Your hair is looking good. There's no contouring of the skull, no bruises, no bumps, no protrusions, no cysts, lesions, and any asymmetry. Your hair, the texture is well distributed. I don't see any abnormalities upon my inspection, which is a good thing. Now I'm going to palpate again to touch. So I visualize it and I palpate it, but I'm going to palpate again to touch your head. And as I mentioned, your hair is distributed and it's even texture. There is no depression, no protrusions, no cysts, no lumps, no bumps, no hematomas. Everything is normal in the finding. I am going to use a Q-tip. I'm going to open your hair and assess your hair further. May I mess up your little ponytail? Thank you. Again, no abnormalities noted. Everything is okay. She doesn't seem to have any alopecia. I'm going to place the Q-tip back. The next part of the assessment, I'm going to inspect your eyes, and I'm going to do a general inspection of your eyes. I'm going to inspect that there is no inflammation and if that it's symmetrical. May I look? So I'm inspecting the eyes. It's symmetrical. There is no inflammation, no redness. Checking the sclera. Sclera is not yellow. so you don't have jaundice. I'm going to look at your iris. Okay, your iris is round and it's uniform. In its uniform, your cornea appears to be smooth, and I'm going to gently pull down on your eyelids to check for conjunctivitis, which is like redness, pinkness. May I please do so? Thank you. No redness, no noted, no discharge. It's pink, smooth, and moist. I do not see any excessive tearing or dryness, and your eyebrows and eyelashes are symmetrical and growing uniform in a uniform direction. Like your eyebrows are growing fine. The next part of my assessment, I'm going to use a saline test. This little chart, and this is going to, am I still on visual? Yeah. And this will conduct a visual acuity test for cranial nerve number 2, which is the optic nerve. I'm going to ask if you're wearing any glasses or contacts, any cataract surgeries or any of that stuff. Okay, and I'm going to stand about 6 feet. For the purposes of this video, I'm not 6 feet. I'm going to say I'm 6 feet because I will be out of range of video. So we're going to pretend I'm 6 feet away from you right now, and I'm going to have you cover your right eye. And are you able to read the smallest line?
Yes. LTFPH.
Can you cover the left eye?
LTFPH.
Can you read the line with both eyes?
LTFPH.
So your visual acuity is 20/20. Your right eye and your left eye is 20/20. The next test I'm going to do for this video, we're supposed to dim the lights to check for your pupillar reaction test. I'm going to put this back. But for the purposes of this exam, for this class, we're not going to actually dim it. We're just going to visualize that we're dimming the lights to do the pupillary reaction test. The way I'm going to do this, I'm going to inspect your pupillary reaction in both eyes. So I'm going to do 2 eyes each time, and one time I'm going to check for the eye, the next time I'm going to check for the opposite eye. Does that make sense to you? Okay, and this test is testing the cranial nerve number 3, which is your ocular motor. And to do this, first I'm going to shine the light from side to side of your left eye and check for a pupillary reaction. Ready? Okay, now I'm going to do the same for the right. Okay, now I'm going to do the same, but I'm going to look at the opposite eye. Okay, again. Okay, perfect. I assessed both eyes, and both of your pupils are equal round. Sorry, I had something in my throat. Both of your pupils are equal round and reactive to light. Pupils are constricting equally. We're going to pretend we're turning back the lights on. So the lights are back on. Now I'm going to do what's called a wiggle finger test. It's really fun. I'm going to put this down. And we're going to do a wiggle finger, which is going to test your visual fields. And so what we're going to do is we're going to do this together. I'm going to ask you to close stand in front of you, if that's okay. I'm gonna get a little bit too close to you. Sorry, it might be a little bit uncomfortable, but this has to touch your lash, and I'm gonna have my opposite hand toward your eye. So, right eye, we're gonna start with the right. I'm looking into your right eye. I'm gonna flash a light. Okay. Ooh. Flash a light. Come in close. Open your eye. Thank you. Okay, I'm gonna do the same on the opposite. I'm so sorry. Was that too bright? I think I got it too. So sorry. Okay. Perfect. Thank you so much for allowing me to do that. I'm gonna put this back. Okay, the optic disc was yellowish orange to creamy pink color with sharp margins, and it was central physiological cup ratio was physiological cup to disc ratio. Cup to disc, not the cup. Cup to disc was 1:3 ratio. The arteries were light red, brighter, and smaller, whereas the veins were a little bit darker in color and larger when I reflected the light. Now I will do an extraocular movement using the six cranial, this is on, okay, six cardinal direction of gaze, and I'm going to check for cranial nerve 3, 4, and 6. If you can please follow the pen light, whichever direction I'm going, please follow it as well. So cranial nerve 3 is the ocular motor nerve. Cranial 4 is the tracheary nerve, and cranial nerve 6 is the abducens nerve. And if you can follow it, checking cranial nerve 3. Okay, and we're checking cranial 6, abducens. Perfect. So the extra ocular movements are intact. Movements are smooth and coordinated. The convergence is intact. Accommodation reflex is intact, and no strabisms were noted. Now I'm going to inspect your nose. We are going to look for any obvious different maladies, any sign of trauma, any polyps. And so first I'm going to do is I'm going to inspect. Okay. Thank you so much. And then I'm going to, so based on this inspection, I didn't see any polyps, I didn't see any redness, I didn't see any bruising or any drainage. Now I'm going to, if you don't mind me touching you, I'm going to calculate and feel your, sorry, my hands are a little bit cold, your frontal and your maximal sinuses. Do you feel any tenderness or pain? No. How about here? No. Okay. So my patient does not have any tenderness, which is a normal finding. Now I'm going to inspect the internal and now I'm going to inspect internally, and I'm going to ask you to hyperextend your neck. Thank you. I'm going to take my light and I'm going to inspect. Well, I already did the mucus, the nose, but I'm going to do it again. I remember from my script. So your mucus is, there's no polyps and your mucus is moist. Because there was no drainage and your septum was straight, there was no deviated, you don't have a deviated septum. Also, your nostrils were bilaterally patent. Sorry, my throat. And there was their patent. Now I'm going to do what's called like a nostril test. I'm going to check for your air, for your breathing. If you can just occlude one of your nostrils. What is this? Left up nostril. Take a deep breath in. The other one too. The left one. Occluded. Perfect. So it was patent. Air moves freely. There was no issues with the air. Okay, now I'm going to check for your smell. me, please, for this test? Okay. Can you take a smell?
Coffee.
Perfect. I'm gonna do one more, okay?
Cinnamon.
Perfect. Okay, so that was correct. It is coffee and it was cinnamon. Um, Good job so far. And you're welcome. So we did the nostrils, and as you opened your eyes, thank you. So what we just checked for was your cranial nerve 8, which was the acoustic nerve. Do you have any questions?
No, I do not.
Okay, so sorry, this is a lot. We're almost there. Um, so I'm going to be whispering. So now I'm going to be checking doing the cranial nerve. Sorry, what we just checked. Did I say cranial 8? My mind is everywhere. We just checked the cranial nerve 1, which was intact, and it was. Now we're going to check your cranial nerve 8, which is the acoustic nerve. I'm going to whisper 3 sets of letters and numbers in each ear while I stand 2 feet away from you, and when we close your ears. Are you ready? Okay, can you close your ears? Your what is this? Left ear. 1, 2, 3.
1, 2, 3.
Okay. Oh, let me go behind you. I don't know if I'm gonna be able to close. Can you close the other one? Yeah, the other one, please. I'll just go this way.
ABC.
Okay. Uh, Perfect. You passed the test. Cranial nerve 8 was intact. Now we're going to do the Weber test, which is using a turning fork. I'm going to strap the fork and put it on your forehead. So what you're let me know if you can hear the sound in both ears.
Yes.
Okay. Great. Do you hear it in one side more than the other, or was it equal? Perfect. Which means there's no lateralization, which is a normal finding. It indicates symmetrical hearing. Next, we're going to do the Rhinery test, and that's to check conductive hearing loss by comparing air conduction to bone conduction. Here, I'm going to again strike the fork and place it behind your ear on the acoustics bone. You ready? Okay. Hear it? Perfect. So we just did the same, and we put it on the uh, mastoid bone. And you said you heard everything okay, right? Okay. So this was a positive test, which is a great sign. It indicates our conduction is greater than bone conduction, which is consistent with normal finding for hearing. Now I'm going to palpate your external ear and tragus. God bless you. God bless you. Sorry. Okay. By tugging the auricular of the ear back, up, back, and slightly away from your head. Okay, I'm going to check to see if there's any tenderness while we do this. So I'm doing up, sorry, back. Is there any tenderness or any pain? No? What about this one? Sorry. Any tenderness? Okay, perfect. Now I'm going to inspect the external ear for any like drainage, any inflammation, infection, or any of that stuff. External ear has no inflammation, no drainage, no bruising, no tenderness, which is all a good sign. Now I'm going to check your inner ear. May I do so? I'm going to use a otoscope. Sorry, otoscope to assess the external auditory canal. Okay, I'm going to change this. Okay. I'm going to turn the light on the machine. You ready? Am I hurting you? Any pain? So no no redness, no discharge noted. Over here, let me look at the other one and then I'll talk about my findings. No obstruction or foreign object. Ooh. The left tympanic membrane was pearly grayish. There was no redness noted, no drainage, no bubbling, no fluid. The light was at 7 o'clock on your left side, and the same with the right side. But the right side, it was the light in your ear was at 5 o'clock. So left was at 7 o'clock, and then right was at 5 o'clock. Now we're going to move on to your mouth, throat, and face. I will first inspect to see if there's any abnormalities. I'm inspecting your face, her mouth, and her throat. There's no abnormalities. Color is appropriate for her race. There's no cracking on lips. There's no lesions, no bruising, no plumping, no swelling, and there are no involuntary facial movements that I'm observing. Now I'm going to ask you to please open your mouth for inspection. I'm just going to get my hair light. Sorry, I have coffee breath. That's okay, you're fine. Here we go. Okay, now I'm going to ask you again to open your mouth, please. I'm going to inspect it. Can you relax your tongue? Fast. I'm going to do this a few times, okay, during the thing. Thank you for relaxing your tongue. The tongue seems to, can you open it again? Okay, I'll let you finish, Jenny. That's okay. The tongue lies symmetrical and midline on the floor of the mouth. Now I will be testing for your tongue strength on both sides. If you can just, I'm going to put my hand or my fingertips on the outside of your cheeks. May I touch you? And I'm going to ask you to press your tongue against my fingers. Thank you. I'm going to do it on this side too. Okay. You have, and then can you just perfect things? Thank you again. So your tongue has full range of motion and the strength, which is equal in on both sides. And I didn't note any lesions. It was normal in size, no swelling, no deviation of the tongue, and the strength was intact. And by us checking the strength of your tongue, we were actually checking cranial nerve 12, which is the hypoglossal nerve. And the muscles of the tongue were intact as noted. Now I'm going to inspect the soft palate and the ulvia and the posterior pharynx and tonsils. And for this test for me to do, I'm going to use a tongue depressor. I need you to open wide. Okay, stick out your tongue. Can you do for me? Thank you so much. So the soft palate and the uvula, they both appeared normal in size and they were evenly distributed. Then it remained midline. Your tonsils were visible. They were pinkish, and I would grade them like a 1, which is they're intact, they're not swollen. You don't seem to have any active like swelling and infection going on. The posterior pharynx appears to be pink and moist, and there was no ulcers or swelling noted in my inspection. And we tested again for your cranial nerve 9 and 10, which was the glossopharyngeal vagus nerve. Next, we're going to inspect your neck. I am going to check for any abnormalities, enlargements, any issues that I noted on your neck. I'm going to just look at you. I'm going to put this down. I'm going to look at your trachea as well. Just looking visibly. Again, color is appropriate to ethnicity. No bruising, no redness, no rashes. Everything appears great. I'm still in the field. Your trachea is midline. It looks good. And I'm going to check for range of motion. I'm going to, I'm going to check range of motion for your neck. And for me to do that, I'm going to ask you to please flex and hyperflex, extend your neck. Okay, thank you. Can you Now look laterally to the sides and rotate. Thank you so much. So I noted you have full range of motion. My patient has full range of motion. Now I'm going to test your cranial nerve 11, which is the spinal accessory nerve. And the way I'm going to do this, I'm going to place my hands on your shoulders, and I'm going to ask you to press against it. Okay, you ready? Can you shrug your shoulders? Thank you. Oh, you're strong. Okay, so you're strong. It's symmetrical in elevation, and you were strong to my resistance because I was pressing down. And next, I'm going to check the sternoctomy muscle. And the way I did that is again, that was the sternoctomy muscle. I pressed my hands against. No, hold on. The sternoctomy muscle is the face. Sorry. So now I'm going to check the sternoctomy muscle, and I'm going to press my hands against your face, and I want you to press against it. Thank you. Oh, perfect. So again, that was strong and equal too. Your both muscles are strong and intact. I'm going to move to inspecting your lymph nodes. My hands are cold. Let me try to warm it up for you a little bit. I'm so sorry it's uncomfortable. May I please touch you? Okay, so I'm going to check for your lymph nodes. This is the preauricular, which is in front of your ear, the posterior auricular, which is behind your ear, and then I'm going to do the anterior cervical, which is anterior and superficial to the SCM, and next I'm going to do the posterior cervical anterior edge, which is your collarbone area-ish, and then I'm going to do the submental lip tip of the mandible, which is right here, and so it's pretty much your chin, and then I'm going to do the submandibular angle and tip of the mandibles. And lastly, I'm going to do the supraventricular angle of the clavicle, and okay, I'm going to move to the back. I just hope I'm still visible. Okay, I'm visible. I am checking. Thank you. Sorry. Okay. Thank you. I was checking the occipital base of your skull, occipital base of skull for posteriorly. Um, Before we started, I checked your trachea, and I mentioned that the trachea was in correct placement, and it's midline and it looks good. I'm going to assess your thyroid. Oh, I'm so sorry. I know we're almost there, but before I do your thyroid, I forgot to mention that your lymph nodes were soft and they were freely movable and they were free. They were like less than 1 centimeter, which is a normal finding. I didn't find anything that was enlarged, and when I was palpating you, you didn't have any pain, did you? So it was non-tender. Everything was great. Now I'm going to move to your thyroid, and before I start, I'm going to again visualize and inspect your thyroid. There's no goiter, no enlargement. As far as inspection goes, the color is again appropriate to ethnicity. I'm going to enlargement, and I'm going to ask you to swallow for me. Perfect. Your thyroid appears to move up and down symmetrically, which is a normal finding. One side's not larger than the next. Next, I'm going to palpate your thyroid. May I? Thank you so much. So what I'm trying to do is I'm trying to find the midline, and I'm trying to confirm the cartilage, and the cartilage is moving down to preauricular cartilage and below the trachea. Okay, perfect. Can you